That was it. So if that's all I did, there's some valuable information here for the doctor and for you, the dental hygienist. I'm going to turn the percentages on, and you can see very clearly that if I'm dividing my mouth in half, 53% of the force is on the left, 46 is on the right, and this little trajectory is that little tail that I talked about. Now, in this case, I start here and go all the way over here to center. So really, I'm pretty balanced in the end because this is a little football field here, as I say to the patients, which our goal is we want to end up in there. If I'm to play the movie through for you, use your arrow key. Okay, you see very quickly what happens. This tooth comes into contact, so keep that in mind when you're using your assessment. So if that tooth hit contact first, then I go kind of to center, and this is all in time. Paper can't do that. And then all of a sudden this red spike shows up over here in the upper left molar region. And look at how quickly these several red come into play. Now, all of these numbers mean something. I don't want to get into that with you, but in a nutshell, I want you to, if I'm in your chair and you see that perhaps I have some unexplained perial pockets in this area, or maybe I have a heavily restored tooth in that area, or I have a sensitive tooth in this area, or I have a slight recession starting here. Now you can together, the patient might not understand slight recession or a 4-millimeter pocket that's not bleeding. They might not feel a need for anything there. But when you show them this graph and you say, look at, you've got all these forces here. This tooth is on its way to possible breakdown. We want to get in and do something about it now before it breaks down. That alone allows you to use that information to educate your patients to have whatever procedure they may have. And everybody's going to present with obviously different things. So that's a good example of how you can use the TScan data just having a patient bite. Now, there is a dentist that I'd like to give credit to, Dr. Robert Supple, and he's in Albuquerque, New Mexico, and he has really been using TScan in dental hygiene for many, many years. In fact, I think he has 5 handles, and I mean, part of his exam is, yes, Mirror Explorer Perio Probe and a TScan handle. And the information that he has gathered from this, the TScan has really had a positive impact on his diagnosis as well as on the building of his practice, because this information is huge. It just really can when you relate it to the other things that you are currently doing, it can be a valuable marketing tool. So if all you did was had the patient bite once, or another one would be to have the patient bite a few times, which I'll do next. I'll just save this here, so it's very quickly, you can save it very quick, and then you go and you do another movie. I'll show you what Dr. Supple does. So I actually got 3 clenches. So consistently, you can see that trajectory. I bit 3 ways consistently. I start here, go here, start here, go here, and it's very consistent. So those are my 3 clenches. And it's really good information to show the patient that each consecutive time they're always heading to that direction. And every time that those teeth come together, 2,000 times a day when they swallow, and if they're a bruxer, then we're really going to be in big trouble, that there's an opportunity for breakdown, and that could be posing problems with what's going on with them. So you can also use the TScan to take lateral excursive movements. So in fact, I'm going to do the next few movies without taking the handle out of my mouth so you can see how quickly you can gather the data. The instructions that I give the patient for the lateral excursive movements would be bite down hard and hold and slide your teeth all the way to the right and open. Then I would stop the movie, start a new one. I can do all of this right from the handle. So obviously, I'm my own patient right now. I won't be able to speak to you, but I'm going to do 3 movies in a row, and the purpose is to show you how quickly you can gather the data, and it's not going to encompass too much of your time. So I just did right up lateral excursive movement and a protrusion. So basically that, I don't know what the timing on that was. Well, we could check when I go to save the movies. It was less than 30 seconds. So it really is not going to be something that takes away from what you're currently doing. It's just going to only add. And you don't have to spend hours explaining all of this to the patient. You really use the information. I closed the graphs and, you know, I simplified it by shutting off, you know, all of the individual tubes because I really want the patients to see just a few things. I don't want them to see everything. And sometimes too much information is overwhelming, but this is really straightforward. This doesn't take an engineer to realize that if all of the forces are here in this area, long term it's not good. And you can use an analogy. I mean, if your tires aren't balanced, you wear them out and you have to replace them more often. And if you don't replace the worn out tires, then you know your wheels get out of balance, and so on and so forth. So it's a progressive destruction of your vehicle, and this is the same thing that can happen to your teeth. So the beauty of this is that you can use the TScan in dental hygiene to not only help you better assess periodontal problems, but you can use it as a marketing tool to feed dentistry to the dentist. And in this day and age, I mean, they're needing some dentistry to do. They're done such a good job with preventive dentistry that we're not doing as many fillings as we used to. So there are ways that we can use the preventive tools